African Union Trading Company incorporated with its international partners to include a group of developers and data scientists is proud to introduce the electronic medical record to improve the healthcare system in Liberia. The project is based on more than years of research and is geared towards solving the healthcare needs of most third-world countries. The proposed project was first introduced to key government officials of the Liberian government in September of 2021. Studies and reports from the World Health Organization and many non-governmental organizations show that the leading cause of death in West Africa, including Liberia, is due to the lack of adequate surveillance and data processing to identify initial cases from one health facility to another. The electronic healthcare system will aid in the prevention of unnecessary causes of death and medical malpractice in Liberia. Taking into consideration technical feasibility analysis and the time it will take for doctors, patients, laboratory technicians, pharmacists, and healthcare administrators to fully understand how the mobile app to include the web portal will work, the African Union Trading Company and its partners will set up offices within the 15 counties to work with government healthcare facilities, private healthcare facilities, clinics, and pharmacy by providing technical support and training. Administrators to input patient data. Why is this system a permanent solution for the government of Liberia through the Ministry of Health and Social Welfare to consider? Number 1. The EMR system will regulate pharmacies across the country and will help minimize the use of on-the-counter medications and medication that are purchased without a doctor's prescription. There are currently about 112 retail pharmacies in Liberia and over 600 medicine stores in Montserrado County alone. Only 2 of the 71 standardized pharmacies within the country have an informative website. The intake of medication is a very critical consideration and a leading cause of the ineffectiveness of treatment to patients by healthcare providers. Without a system that will measure a patient's medical history, allergies, and current and previous medication intake, it will be difficult to effectively perform patient care. The issues of drug interaction with food, drug interaction with another drug, drug overdose, and many others will gradually be eradicated in Liberia. Number 2, the EMR system will aid in the recognition of previous medical history. The lack of adequate surveillance and data processing to identify initial cases from one health facility to another is the number 1 leading cause of death in Liberia. For example, a patient who has diabetic ketoacidosis or diabetic acidosis and has been receiving treatment at a medical facility in the northern part of the country will receive adequate medical attention when he or she travels to the southern part and has an emergency medical situation. Doctors can scan their identification cards or input their name and date of birth to access their medical records. This will help save the patient's life and prevent healthcare providers from giving them a glucose dextrose injection solution, which will lead to death due to them being diabetic. Number 3, the EMR system will help in the regulation of current and future laws within the healthcare industry, as well as create regulatory laws that will further benefit patients within the entire country, of which rural places are no exception. The Liberian Medicines and Health Products Regulatory Authority LMHRA, the National Drug Policy of Liberia NDP, the Pharmacy Board, and many other regulatory organizations in Liberia will not function effectively without the comprehensively decentralized EMR system in Liberia. Number 4, the EMR system will make electronic communication effective and possible throughout the healthcare sector within the country. Healthcare providers will be able to electronically order patients' laboratories, and patients will be able to access their medical results right on their smartphones at the push of a button. Patients will be able to schedule their doctor's appointments with their primary care doctors from the comfort of their homes. Number 5, the EMR system will promote a healthy nation by having updated immunization records. The system will keep track of immunization records, knowing which child or children has taken which vaccination, and it will alert parents on their mobile phone when the said vaccination is needed. Number 6, the EMR system will also protect health workers from sicknesses they will be vulnerable to when administering patient care. The system will alert and protect healthcare workers once patient data is processed during emergencies. Healthcare workers will be protected and will know how to administer treatment to patients who are suffering from contagious diseases, including HIV. Number 7, the EMR system will generate revenue for the Ministry of Health and Social Welfare of the Republic of Liberia. The government will be able to have all healthcare providers, pharmacies, laboratories, and clinics mandatorily register with an annual fee to enroll in the system. The Ministry of Health and Social Welfare, with the supervision of the African Union Trading Company, will also distribute both the software and hardware integration to every clinic, pharmacy, and hospital in the private sector that will register for the service. This includes tablets, laptops, and desktops, as well as training doctors, physicians, laboratories technicians, nurses, and nurse assistants with the required training and certification in the EMR system. Number 8. The EMR system will provide educational resources for healthcare providers that will aid in research, diagnosis, and patient care. The system will support a 24/7 online communication forum that will integrate volunteer doctors from around the world. We recognize the importance of protecting patient data and health information. Therefore, patients will sign a disclosure agreement if their medical record is to be accessed from one health facility to another for the continuation of treatment. Only emergency treatment data will be accessed by physicians, whereas full medical records will be accessed by medical doctors. For the efficiency and effectiveness of the system, the African Union Trading Company and its international partners will provide all services, including software, hardware, and technical support. The first 1,500 units of 2-in-1 Windows tablets and PCs to supply to medical doctors, physician assistants, pharmacists, and medical students in Liberia. The tablets will be loaded with digital textbooks and medical learning software that will aid in diagnosis and treatment. Our company will provide an additional 2,000 desktop computers and servers for use in laboratories, pharmacies, and clinics across the country. Our company is currently working with private healthcare professionals and data scientists from the United States, South Korea, Japan, and Australia, who will train Liberians and set up medical and science laboratories across the country. We are here for Africa, we are here for Liberia. Ghana, South Africa, Rwanda, and many other African countries have succeeded in improving their healthcare system. We believe that Liberia, the oldest independent republic that represented the continent of Africa, can also rise to success with the effort of the newly established administration and the assistance of the African Union Trading Company. The Africa Union Trading Company is of the strongest conviction that the EMR system will greatly impact the entire healthcare sector in Liberia. The implementation will be seen within the first year of the project kickoff. Whenever technology is introduced in a country, most individuals in leadership positions try to reason about the realistic applications of the technology. If the developers of Facebook, Instagram, TikTok, or WhatsApp had then thought about if people were going to be able to use their application, then today such development would not have taken the said path. Citizens from one country travel to another and see the application of implementation and wonder why the said application is not present in the country of their origin. Our goal is to bring the best of the Western system to Africa and improve the healthcare industry while adhering to fair trading principles.